All right. Hello, everyone.
Hello.
Welcome to Pilates and Yoga for Bone Health. My name is Lauren Vichick. I'm a physical therapist here at the community hospital, and I'm joined by my colleague, Sasha Geisler.
Hello.
Now, we are just going to start off with some brief information about our presentation today. We are not a professional production company as much as we'd love to be, but if you have any issues with hearing us, with our masks on, or with viewing anything we do, please feel free to send a message in the private chat function on the computer, and we will do our best to attend to it as we go along. So, any questions or concerns before we get rolling? Yeah, we'll pull up our chat box. Well, with that, we are going to get the ball rolling then. So like I said, welcome to Pilates and Yoga for Bone Health. We are going to start with just a little introduction presentation before we go into our exercise portion. So let's talk a little bit about our class objectives today. So following this presentation, participants will be able to discuss indications for exercise in individuals with low bone density. You will be able to identify contraindicated movements and exercises to reduce the risk of fracture, and you will also be able to perform a safe home exercise program without risk of fracture and injury. So let's talk a little bit more about osteoporosis. So quite literally, osteoporosis means porous bone. It is defined as a gradual loss or thinning of bone tissue and bone density that predisposes one to an increased risk of fracture. And we'll talk a little bit more about why that is. Now, osteopenia is a precursor to osteoporosis, and it's characterized by a decrease in bone density. So many of you have probably heard these terms thrown around, whether at the doctor's office or with friends. So just to clarify what osteoporosis and osteopenia reference. Both osteoporosis and osteopenia are diagnosed with a bone density scan, and this is oftentimes prescribed by your primary care healthcare provider, whether that's a physician or a nurse practitioner, but that is who you would go to get a bone density scan prescribed for you. Now, this is just a nice image to give you a little bit of an idea as to what that osteoporosis looks like within our bone. So on the left-hand side, you can see our normal bony matrix in a healthy individual. On the right-hand side, we have our osteoporotic bone. You can tell based off of the difference in the pictures that that bone that is osteoporotic has larger spaces, is less dense, and therefore, if it were to sustain any compression or trauma, it's more likely to fracture and cause injury. So let's talk a little bit more about why this is important. Let's talk about our epidemiology of osteoporosis. An estimated 1 in 5 American women over the age of 50 have osteoporosis. This is most likely thought to be due to a drop in estrogen, especially after menopause. At 50, a woman's risk of fracture is then greater than the risk of breast cancer, ovarian cancer, and uterine cancer combined. It's a significant health impact. Nearly half of women over the age of 50 will suffer a fracture. And we don't want to neglect our male counterparts. About 1 in 5 men over the age of 70 will also suffer a fracture, and this is suggested to be due to a decrease in testosterone as men age. Now, compression fractures of vertebrae are the most common form of fractures caused by osteoporosis. 1 in 5 women who suffer a vertebral fracture will suffer another one within a year. And studies show that up to 700,000 vertebral fractures occur each year in the US, which is quite a significant amount, especially if you take into consideration that this is more than hip and wrist fractures combined. So let's talk a little bit more about that compression fracture. This is a really nice image depicting our spine and our vertebrae, those bones within our spine. On the left-hand portion of the screen, you can see a normal curvature of the spine, and that arrow indicates the normal force that that spine sustains. Now you can tell based on the direction of the arrow that that force is nicely dispersed throughout all the bones. Now, as we get older, we tend to move into a more kyphotic posture. This means a more forward flexed posture. Now, along with that, you can see the change in the shape of our spine that occurs. And with this, the change in the force is then pinpointed to a smaller area, meaning those bones are more likely to sustain injury. Again, if we're discussing someone with low bone density, they are more likely to, as you age and as you become more forward flexed in your posture, sustain injury through those bones that are taking on that force. Now, this is just another depiction of those bones that we just discussed. So you can see pointed out there is that compression fracture and that body of that vertebra, the bone in your spine, and how as it sustains those forces, it can break and cause injury. So now that we've scared you all, obviously we have the question of, is exercise safe for individuals with osteoporosis? And yes, it absolutely is. Otherwise, we would not be here together today. So I am going to pass it off to Sasha, who's going to talk a little bit more about that exercise piece for bone health.
Thank you, Lauren, for that introduction.
Of course.
So we're going to go ahead and do a little bit of an outline about the types of exercise that are appropriate for folks with low bone density to reduce risk of fracture. And we're also going to talk about the type of exercise that should be avoided in individuals with low bone density. We're getting some questions about whether or not we'll be exercising. We've got just a few more slides to go through. And then we will get to the exercise component. So let's talk real quick about the evidence surrounding exercise for individuals with low bone density. So there have been a lot of studies about this, and the studies in general support exercise as an effective and safe intervention for individuals with osteoporosis or osteopenia. Current studies show that exercise is not necessarily effective at increasing the bone density, but it is helpful at reducing the rate of bone density loss as we age, especially in that perimenopausal time or in a little bit older for men. And it can help slow the progression of bone loss, reduce risk of falling, which can reduce fracture risk, and improve overall strength and flexibility. So we're just going to touch on this really quickly. We won't spend too much time on it. But our peak bone mass in females actually peaks around age 18. So by the time women or young ladies reach the age of 18, they have built up most of their bone mass that they will have for the rest of their life. And then, they sustain it for some period of time. And then in the perimenopausal period, it does tend to decline. For males, this is a little bit older, around age 20. Peak bone mass is where it's seen, and then again sustained over time, and then starting to decrease more rapidly around the age of 70. And as Lauren mentioned before, this is partly due to endocrine changes, estrogen production in women, and testosterone production in males. We're going to just touch briefly also on the dietary considerations for folks with low bone density. Wrong way here. There we are. So vitamin D and calcium, as many of you are aware, are very important for maintaining healthy calcium absorption and bone density. On the left-hand side, we have a scale that is from the NIH, and if you want to find this, you can find it on their website under the osteoporosis section. But it just outlines the recommended daily dose of calcium based on age and gender. On the right-hand side are some food sources of vitamin D. So fatty fish, egg yolks, liver, anything fortified with vitamin D. Those are pretty readily available in supermarkets these days. This is going backwards. There we go. So let's talk a little bit more about the exercise evidence, since that's what our class is about today. So there was a study done in 1984, which I recognize is quite a bit of time ago, but it was a really meaningful study and a really important study when it comes to outlining the appropriate type of exercise for folks with low bone density. And the study was done looking at different types of exercise and the effects on risk of compression fractures and in the vertebrae specifically. So the individuals in this study were split up into one of four groups. The extension-based group, meaning exercises where their spine goes backwards. Leaning back, for example, is an extension movement. The flexion group was another group of folks, and that consists of bending forward. So if you think about bending forward and touching your toes or doing a sit-up or a crunch or a curl, that's a flexion-based exercise. The third group was a group that did flexion and extension-based exercises. So they did a little bit of both. And then there was a group who was the control group. They completed no exercise. What the researchers found is that the individuals in the extension-based group, 16% of them sustained compression fractures in their spine. In the flexion group, 89% sustained a compression fracture. That's a huge, huge number. The individuals who did both flexion and extension, 67% of them rather, sustained compression fractures. And the control group, about half of them sustained a fracture. So this study was really meaningful when it came to rehabilitation for folks with low bone density. And the study was actually repeated a number of times later on and was stopped by the IRB medical boards because there were such profound differences in the flexion and extension-based groups that were basically just acknowledging the fact that extension exercise is going to reduce your risk of fracture. In fact, it's better than doing no exercise. It's better than doing a combination of the two. But at all costs, we want to avoid flexion-based exercise because you're almost guaranteed to sustain a compression fracture. So again, the difference is the movement of the spine. And I'll do a quick demonstration, and you'll see this in our exercise component. But extension-based exercise involves leaning back. Your spine is going in the backwards direction versus flexion-based, where you're bending forward at the waist. Okay, bending forward is something that we should avoid because if you have low bone density, because according to this research, it causes a much greater likelihood of sustaining a compression fracture. So now that we know to avoid flexion-based exercise, let's talk a little bit about how are we going to incorporate exercise with Pilates and yoga in a way that's safe for individuals with low bone density. So there will have to be some modifications made, and we will go through those today in our class. But ultimately, we know that Pilates and yoga are safe interventions. They focus on posture, alignment, breathing, awareness, flexibility, strength, and core control. And much of the focus is on maintaining a neutral spine position. Now, the neutral spine position is great for core strengthening because it doesn't put you into that forward flexed position that a lot of other core exercises like crunches or sit-ups do. They use body weight resistance, which has osteogenic effects, and that helps slow down that rate of bone density loss in the aging adult. Strengthening effects, we can strengthen our muscles, of course, through these forms of exercise. We can strengthen the back extensors, and the back extensors are the ones that help you get into that extension-based position. That's going to, again, help reduce the onset of that forward flexed kyphosis that we often see in aging adults, especially those who have known osteopenia or osteoporosis. Pilates and yoga also help improve balance and core stability to help prevent falls. Doing great here. So with regards to the considerations for exercise, you want to maintain neutral spine throughout all of your core exercises. And we'll go through this again with our exercises, and we will also review this at the end because this is the most important thing, is that you avoid flexion-based exercises, specifically, you know, crunches, curl-ups. There's a machine I always see at the gym where you basically are lying back and you crunch forward. Please don't ever do that exercise machine if you have low bone density or if you're perimenopausal or an aging male. Just don't do it. It's not worth it. And maintaining an active core throughout these exercises is going to benefit you. All right.
Let's get exercising.
Let's move on to our exercise component. So what we'll have everybody do is go ahead and find a place where you can do your exercises if you haven't already. You will need to be able to get to the floor.
We're going to do a brief shuffling of our setup as well so that we can put down a mat.
Or Lauren, I'll hand you the microphone.
Perfect.
For purposes of your visual of my moves, I'm going to have my mat this way, but you can all feel free to stand in this direction on your mat. And this is more just so that everybody can see me.
All right, so we are going to start off with a few stretches, just a gentle yoga flow to work into that balance work and also some strength work. So Sasha is doing a wonderful job starting here in mountain pose. You are going to bring your feet together, arms by your side, taking a few deep breaths just to begin. Now, feel free to close your eyes here as well, just to get an added component of balance work. Now, with anything that we do here today, if you feel unsteady, please feel free to stand next to a solid piece of furniture like a chair to help you maintain your balance as needed. And with that, let's go ahead and reach our arms out to the sides, up overhead, and bring them back down. Now, this brings up a wonderful opportunity for you to start to use those core muscles, those stomach muscles. So as you take a big deep breath and reach those arms up and out to the side, feel like you're drawing up those muscles at your stomach up and in to start to activate them just a little bit more. Beautiful. All right, now from here, I'm going to have Sasha turn to the side to show you a few poses. I want you to step forward from here into a lunge type position. And we're just going to hold to begin with right here. Again, feel like you are drawing up and in with those stomach muscles. Beautiful. Now, while we're here, go ahead and turn your back foot out to the side. As you do so, feel free to stretch your arms out to the sides as well, making sure your front knee is nice and aligned over your foot. Sasha's doing a wonderful job here. You want to avoid any caving in of that knee, especially if you have any knee pain. Now from here, we're going to get a little bit of that extension movement in. Sasha's going to drop her back arm down and reach her front arm up, keeping her stomach muscles held nice and tight while she does, taking a few deep breaths in through here. Excellent. And drop that arm down, rotate that foot forward again, and step back in. We're going to repeat this to the other side. So go ahead and step that other foot forward, pull those stomach muscles up and in, activate those core muscles. Take a couple of deep breaths here to get started with. And then when you're ready, Bring that back foot around, just like Sasha's showing you. Feel free to stretch your arms out to the side. You can bring them down to your hips if you have any shoulder issues or anything like that. And again, Sasha's doing a fantastic job of keeping her knee aligned over her foot, drawing her stomach muscles up and in to work those abdominal muscles. And then drop that back arm down, stretch it up overhead into that slight back extension while maintaining that stomach stability, holding that core in nice and tight. Excellent. Rotate the heel back to the front, step it back in. Wonderful. We're going to go into a tree pose now, if any of you are familiar with some of these yoga poses. So standing facing forward, you're going to draw your arms out to the side. Now, some people like to do arms on the hips. If this is within your shoulder range of motion, some people like to bring the arms all the way up overhead, and you're going to draw one foot up and in. Now, this may be challenging for some people. If you want to, feel free to keep that foot just kind of down by the floor, touching down with one toe. Always stay safe with whatever decision you make, whichever form of the exercise you do. And we'll hold here just for a few deep breaths. It is normal to get a little wobble at that foot in through here. Just keep pulling those stomach muscles up and in to keep everything nice and tight. Sasha does a beautiful job of this. Go ahead and lower that foot down. We're going to reverse to the other foot. So open those arms out to the side, whichever manner you would like to. Draw that foot up and in. Again, you can always have a piece of furniture nearby, holding on with one arm or touching down just with one toe on the floor. And you can see Sasha's doing a few of those arm variations that you can work in. We're really mixing it up here. I like it a lot. Whatever feels good for you at home. Excellent. Bring that foot back down. Wonderful. So let's move in to a few Pilates-based movements for a little bit more strength work now. So I'm going to switch with Sasha.
All right, so everybody, if you could slowly move down to your mat, Lauren can demonstrate to you a safe way to get down to your mat that doesn't involve bending or twisting your spine, because of course that's something that we're trying to avoid. So coming down onto all fours is another option. If you like to hold on to something to get down to the floor, you can certainly do that. But we're all going to start in what's called a hook line position. So knees are going to be bent, feet are flat on the ground. All right. You can keep your hands on your hips or even under the small of your back if you like. And what we're going to do is we're just going to build the foundation for the coming exercises that we'll do in today's class. So what I'd like everybody to do while you're lying down, I'd like you to imagine that you're pressing your low back down into your yoga mat. So you're pressing down. As you press down, I want you to feel those abdominal muscles tighten, okay? And then go ahead and relax and rock your pelvis forward. Go ahead and rock your pelvis back again, pressing your low back down into the mat, drawing that belly button in towards your spine. So really feel the stability in those lower abdominals as you press down. So maybe repeat a couple of cycles of that so that you can really activate those muscles that we're going to use throughout the duration of these exercises. So now go ahead and hold that position, that low back slightly pressed down into the mat. Abdominal muscles are nice and tight. And bring one foot a couple inches up off of the mat. Slowly lower it down. Repeat on the opposite side. So you're slowly marching in place while keeping those abdominals engaged. Thinking about tightening those abdominals even further every time you lift your foot up off the floor. Very nice. So really, these are the foundational stabilizing movements that you need to be able to maintain that keep your spine in a neutral position and avoid any excessive compression on those vertebral bodies, which could potentially result in a compression fracture. Now let's go ahead and move on to our progression. Now that you have the basic pelvic tilt and core stabilization, let's go ahead and move into a leg extension. So keeping that low back pressed down into the mat, extend one leg out in front of you, hovering it over your mat, and then bringing it back. Switch to the other side. Now, as you go through this, what you might notice as you extend your leg, your back might want to slightly pop up off the mat. You really have to engage those core stabilizers to keep your low back pressed down into the mat and engage those abdominals. Good. Slowly alternating from left to right. Again, deeply activating those muscles every time you extend your leg. It's great. Lauren's doing a really good job of keeping very stable with this. Her abs are going to be sore tomorrow because we practiced this earlier today as well. So now, as you extend your leg, we're going to make it a little bit more challenging. You're going to extend one arm behind you, the opposite arm, and then the opposite leg in front of you. Now, you'll notice even further that as you do this, your back is going to want to pop up off the mat. You really have to engage those core stability muscles to keep your low back pressed down. Good. Very nice. Great stability there, Lauren. Now, this is a foundational exercise called the dead bug. It's a great place to start. If you are somebody who has a little bit more strength and stability and you want to progress, we're going to move into the tabletop version of this. Now, what I'd like to point out is that Lauren's bringing up one leg at a time, which is great because it decreases the load and compression on the lumbar spine. The closer your knees are towards your chest, the less challenging it is. The further your knees are from your chest, the more difficult it is. Did I mix that up? No, okay. So try to find where you feel like you really are getting those abdominals engaged. It shouldn't hurt your back. If it does hurt your back at any point, come back into the hook lying position and do it as we did from the first round. So for those of you who can tolerate the progression, come into tabletop, and we're going to start with a reverse march. So one leg will slowly tap down to the mat, come back up, and switch to the opposite side. Good. Now again, as you're doing this, you'll really feel that back want to arch up off of the mat. As you lower the leg, you really have to engage those deep core stabilizers to keep your back pressed down in that neutral position. Very nice. Now, like the hook lying exercise, the progression here from the march would be the leg extension. So you'll go ahead and slowly extend one leg. Again, really keeping care in those abdominals to not let that back pop up off the mat, alternating from left to right. Good. I'm going to hydrate here a bit. Hopefully you all are hydrating at home. It's a hot day.
It is a warm day.
I'm not even the one exercising. Very nice. Now, again, the further progression is the opposite arm reaching behind the head. Now, this is a lot of challenge on those deep abdominal core stabilizers. So you really have to work hard to avoid that back from popping up. If you start to feel your back muscles working, it probably means you're not ready for this exercise yet. You really should not feel your back muscles engaged. It should be entirely concentrated in the front part of your body, in your abdominals. Okay, so we'll go ahead and do a couple more repetitions of that. Then we're going to go into our bridging. Good. And again, Lauren brought down one leg at a time from that tabletop position. It's a lot less stress on the lumbar spine, so one leg at a time. So now for a bridge, go ahead and get back into that hook lying position. Feet are flat. And you're going to go ahead and slowly lift your hips up off the floor. All right, and slowly lower down. Now, as you do this, think about really squeezing your glutes and engaging your abdominals to lift up. So almost like you're going into that little bit of a pelvic tilt as you kind of roll up. So tightening the abdominals, tightening the glutes, and lifting your hips up off the floor. Now, I love bridges because it is actually an extension-based exercise. So it's fantastic for anybody with back issues, but especially folks with low bone density. There's a lot of variations of bridging too. So you can bridge with your toes kind of lifted up, on your tiptoes with your heels lifted up. You can bring your feet wide and do bridges. So there's a lot of different ways to kind of keep this exciting so that you're targeting different muscle groups and not getting bored of doing the same thing. So let's go ahead and do a couple more repetitions of those bridges. And then we're going to come into our next position, which is a yoga tabletop. So hands and knees. So slowly roll over to one side and flip over onto your hands and knees. Check our Q&A here real quick and make sure there's nothing. Sasha, hold the mic closer. Okay, hopefully I'm doing okay with that. So go ahead and in this position, I want you to situate your knees directly under your hips and hands directly under the shoulders so that you're nicely aligned and it keeps the stress off of your wrists and knees. Now, really tighten up those abdominals. I'm actually going to have Lauren lift up here just a little bit to kind of engage those abdominals and make the low back very nice and flat. Imagine you have a glass of water sitting on your back. You don't want it to fall off. Now, let's start with the leg extension. So take one leg and stretch it out behind you, but keep in mind that glass of water is still sitting on your low back. You don't want it to fall off. Come back down, alternate left to right. I like that I'm not getting a lot of comments because it makes me think everybody's on the floor doing their exercises, which is the whole purpose of this class. So starting to feel sore. Good. Now, for those of you who have better core stability, who feel comfortable with progressing, go ahead and take the opposite arm and reach it in front of you. You can hold it for a couple of seconds, come back and switch. Again, keeping in mind that glass of water, we don't want it to move, we don't want it to tip over. So nice, strong, stable core. Try not to rotate your trunk. Nice correction, Lauren. I saw her tighten her core again, flatten her low back a little bit. This is great. Very nice. If you start to feel extremely wobbly, take note. Are you extending the arm and leg on the same side? Because it's going to be really hard to balance if you do. And I see people do this all the time in the clinic. So make sure you're extending the opposite arm and leg, the right leg and left arm and vice versa. Good. Okay. So we're going to go ahead and come down onto the belly, all the way down, flat on the belly, and prop up on your elbows. Now we're going to go into a plank. But before we do that, I want to take note of the position Lauren is in. This position that Lauren's in was the extension-based exercise that was part of that study that looked at compression fractures in folks with low bone density. So simply doing prone press-ups, which is essentially where we are here, going up and down from your belly, pressing up, was the exercise that was shown to significantly reduce the risk of compression fractures. So we will end our class with this prone press up, but I wanted to just kind of introduce this exercise now since Lauren is beautifully demonstrating her prone positioning. So let's go into our plank. So there's three forms of plank that we'll cover. All right, so the first one is plank on the knees. So you're going to go ahead, lift your hips up off the mat and keep your feet up off of the mat as well. Now you'll notice that Lauren is doing a great job of maintaining a nice straight line from her trunk through her hips. She's not sagging. She doesn't have her butt lifted up really high. She's in a nice straight line. Now, for those of you really strong core carriers, let's go into a plank on toes. So you can also do a plank on the toes from your elbows. Again, Lauren's in a nice straight line. Her hips are not elevated. They're not sagging. She has a nice flat back right here. She's not dipped down or arching her back. Now, the last modification is a full plank on extended elbows. All right. And so again, what people tend to do is be a little too saggy here. So lift up your hips just a little bit higher and really think about even tucking that tailbone under a little bit, because then you're going to engage those abdominals a bit more. All righty. So we're going to go ahead, come on down. Lauren held a really nice long plank there.
So you in there.
Let's go on to your side. So either side, Lauren's going to start on the right, but either side is fine. We're just going to make sure you switch after you do this exercise. So we're going to do a side plank. So on your elbows, knees and feet together, you're going to go ahead and lift your hips up towards the ceiling. Now, make sure that you've got your elbow directly situated below your shoulder. So Lauren's got a nice straight line from her shoulder down to her elbow on that right side. And that's going to take some of the pressure off her shoulder. Good. You can even reach one arm up. If you feel like you want more of a challenge, you can stretch out the top leg. Or you can come up into a full side plank with both legs straightened out and your knees off the floor as well. All right. And if Lauren's feeling really, really strong, she can also lift up that top leg. I just had to have her show off for you all. So come all the way down onto your side again. And we're going to go into a side-lying hip strengthening series. Now we're going to do these 3 exercises on this side, and then we'll flip over and do the plank on the other side as well as the hip strengthening. So the first one is the hip abduction, the hip leg lifts. So stretch the top leg out in front of you, keep the bottom knee bent, and you're going to lift that top leg up and down. Now make sure that you've got your knee nice and straight, okay? Your hips are stacked one on top of another. You don't have your hips kind of rolled back or forward. You're going in a straight up and down motion. You also want to make sure your toes are pointed at the wall in front of you and not pointed up towards the ceiling. Those are some common compensations we see with people doing these exercises. Very nice. So we'll go ahead and do about 10 repetitions on the side. And again, for those of you at home who want more of a challenge, you can do more sets and more repetitions of these. We typically recommend 2 sets of 10 repetitions, but you can certainly do up to 15 repetitions or do 3 sets if you feel like you need a bit more of a challenge. All right, let's go ahead, bring those feet together and knees together. We'll go into our clamshell. So now knees bent, you're going to go ahead, keep the feet together and lift the top knee up towards the ceiling. Now again, you want to try to avoid letting those hips roll back. A lot of times people roll that top hip back as they lift their knee up towards the ceiling. You don't want to do that. So you can always put your hand on your hip and kind of guide your hip forward so that you know you're not leaning or rolling backwards. Again, keep that core nice and stable. Your core can be activated through all of these hip exercises as well. Very nice. Let's go ahead and do maybe 5 more of these, and then we'll switch to the other side. And we're asking, have a question about whether we'll get a copy of these. This class will be recorded and sent out to you. All righty. For those of you who were there for our last class, it was the hot question of the class, and we did take a while to get the video sent out, but we are actually recording live, so you will get this video sent out to you after the class. So we're going to go into the side plank on the left side. So knees together. We're going to go ahead and lift the hips. Now again, any of those modifications can be made. You can stretch out one leg, you can reach the arm up, whatever you are feeling. Very nice. And Lauren's going to have to keep it even on both sides and lift up that top leg here. There we go. Very nice. All right. And so we like to shoot for about 30 seconds. Some people can hold a little longer. Some people can hold a little shorter. Everything is okay. Just meet the exercises where you are. Don't try to go beyond your ability level. But if you do need a little bit more challenge, just go longer. All right, go ahead and come all the way down onto your side. We're going to go into those hip abduction leg lifts. Okay, so stretch that leg out in front of you. You're going to go ahead, lift up and down. Very nice. So again, 2 sets of 10 repetitions is a really great place to start for these exercises. You want nice control. You don't need to do it really quickly. So again, you're trying to really isolate the muscles and have good form so that you can strengthen the muscles that you're trying to address here. And this one, you should really feel it in the side of your hip. All right. Next, we'll go ahead and go into our clams. So feet together, knees are bent. You're going to go ahead and lift that top knee up, again, without letting those hips roll back. Keeping the hips nice and stable, engaging that core is really going to help you with that stability. It's doing a great job maintaining good form. Very nice. So this will be the last of our strengthening exercises. Again, there are so many more Pilates exercises and yoga exercises that can be done. Of course, for purposes of time, we can't go through them all. But there's some really great apps. There are some wonderful YouTube videos. If you go onto YouTube, you can search yoga for seniors or yoga for runners or yoga for pretty much whatever and find some great videos. Go ahead and just do some, exploring of that platform. Again, there's also some great apps. If you look up on the App Store, if you are into using the iPhone or a smartphone, you can always look up yoga or Pilates apps as well. So let's go ahead and wrap things up with some yoga exercises, just like we started. So we're going to start in a child's pose, all right? So go ahead and come onto your hands and knees. And you're going to go ahead and sit back onto your heels, keeping your hands in front of you, stretching those arms out nice and long, all right? Now, you may or may not be able to see, but Lauren has separated her knees. Her feet are still close together, but she spread her knees apart so that she can sink down lower into this stretch, all right? Reaching those arms nice and long in front of her. Getting a nice stretch through the shoulders and the back, the glutes. Okay. Now from here, we're going to go ahead back onto the hands and knees, and we're going to transition into a downward dog. So go ahead, tuck your toes under, and then go ahead and shoot your hips back, straighten out the knees, press through those hands until you get a nice, strong push through those hands and a nice straight line through the back and the shoulders. Really pushing the energy through those hands, pushing towards your heels. You can walk your hands back a little bit if you need more of a stretch. You can even try to push those heels down to the floor, pedal those heels out, whatever feels comfortable to you. Good. All right, now take one leg, reach it up behind you. We're going to go into three-legged dog, and then bring your ankle towards your opposite elbow. We're going into pigeon pose. Now this is a deep stretch, okay? So depending on your flexibility level, you might just kind of hang out, right, like Lauren is, with your arms straightened and your chest elevated, okay? Now, if you are a bit more flexible, you can certainly come down onto your elbows, okay? Just be mindful of not overly flexing your spine, okay? I know for myself, I definitely feel it with just the arms straight, okay? So you're gonna hold this for about, 20 to 30 seconds, right? And then from here, we'll go ahead and we'll come back into our down dog. So flex your back foot, push up and come back into that down dog. And go ahead and switch to the opposite side. Lift that opposite leg behind you, three-legged dog. Bring that leg in into pigeon pose. Ankle to opposite wrist. Go ahead and sit back into that pigeon pose. Good. If you feel like you've got a little bit more flexibility, you want to come down onto your elbows, by all means, go for it. But if you feel a good stretch here, no need to push it further. Again, this is all gentle. Nothing's meant to be intense or strenuous. So if you feel a stretch, you're probably good. You don't need to push it to the point of pain. There's no point in doing that. Right. Okay, let's come back into the down dog. One last stretch here. And then slowly come onto your knees and then down onto your belly. Prop up on those elbows. We're just going to do a gentle cobra. So if you have the flexibility in your spine, if you don't have pain, okay, you can go ahead and press up through your hands, taking a deep breath in. And if you feel like you can extend your elbows, you can do that too. Now taking a deep breath in and exhaling, letting those hips drop down a little bit further. Good. Alternatively, if you don't have great range of motion or flexibility in your spine, you can lie flat on your belly. Now, prone lying is actually a wonderful thing for your spine. Again, it gets you into that extension position, and that's one of the most important things we know to help reduce the risk of compression fractures. Now, if you've already had a compression fracture, you might find that this is a little uncomfortable. So what some people will do is maybe put pillows under their hips, but again, trying to get as flat as you can in order to get in this prone position is something that is going to be really valuable to you. So playing around with what you can tolerate at home, pillows under the hip, under the chest, whatever you need to give yourself a little added support. All right, so that wraps up our exercise component. I'll give everybody a few minutes to kind of rise up and get organized. We're going to resituate our setup here. All right, so we're all unmuted here.
Well, thank you so much for joining us today.
Yes, and we lost our presentation because I closed it out and I'm not quite sure how to bring it back up. The most important thing, let's do a quick, actually, I think I do know how to pull it back up. So questions about engaging the core. There's a question about how we do that.
Great question. You know, when we talk about the core, oftentimes we're referring to our stomach muscles or those abdominal muscles. The core is made up of some of the muscles in our back and of hip stabilizers as well, but we oftentimes are thinking of those stomach muscles. And one thing that we use pretty readily to encourage patients to activate those muscles is to think like you are drawing your belly button towards your spine. Or sometimes people will think of zipping up a really tight pair of pants. So just, you know, tightening those stomach muscles in whatever manner you can to help support the back. And if this is something that you have, you know, further questions on and wanted to work with someone one-on-one with, you are always more than welcome to find a local physical therapist, and they would be happy to help you find your core. We do it all day long with patients.
It takes time. I have worked with people where it takes weeks to find the core, so that's not unusual either.
Absolutely, you're not alone.
So no twisting movements. That's correct for the most part. Now, there's always some, you know, we need to flex throughout our lives. It's something that we do. The idea is to avoid loaded flexion or twisting. So for example, bending and twisting to lift something. It's a terrible idea. We should never do it. So twisting aggressively, rapidly should, yes, be avoided. Now, if you're doing a gentle trunk rotation type stretch, for example, or very gentle type stretches that are nice and controlled, that is typically okay. But again, if you have specific questions, you can always see a physical therapist like Lauren mentioned, so that you can really get a guided program that is specific to you and what's appropriate. Any other questions?
Yeah, any other burning questions right now? We'll give it a moment. Yes, thank you. Yeah.
We appreciate everybody joining us.
Yeah, especially on this beautiful day.
I know. Hopefully everybody learned a thing or two. The one slide that didn't show up that I just would like to summarize is that focusing on exercises with a neutral spine or exercises that put you into an extension position are pretty much always safe. Again, for special consideration needs to be considered for rotational movements or flexion-based movements. Now, I think that we can put a blanket statement out that says, don't do crunches, don't do sit-ups, don't do Russian twists if you have known bone density issues. Avoid them all. Now, again, if you have low bone density and you would like some more guided information, you can definitely see a physical therapist for that.
And we have another great question. I know we referenced an earlier class today. That class was for exercise for the aging adult, and we did it a couple of months ago now. And yes, that class is actually shared on the CHOMP Facebook page, I believe it is, a recording of it. So please feel free to reference that as well. We always enjoy when people get use out of the materials that we've put together. Yeah.
Any other questions?
Yeah, any other burning questions, thoughts?
Okay. Well, it was a pleasure to have you all in our class. We look forward to doing another one. Can we access it without joining Facebook? Yes, you can.
I believe,
So
yes.
you can look up Community Hospital Facebook and you can still access it. Yeah.
Yeah, good question.
But hopefully we'll see you all again virtually for some classes down the road.
Absolutely.
They'll be posted to the CHOMP homepage and any other avenues that you may have found out about this class. You should get information about future classes as well.
Yeah, keep an eye out.
Wonderful. All right, everybody, enjoy the beautiful day.
Yes, thank you for joining us.
Right, bye-bye.